Hi, everybody. Tonight we will be discussing autism, empowerment, and acceptance. Welcome to the Friendly Counselor Live. I am Dr. QUITA Roberts, and we will be speaking with a guest, Dr. Aretha Becca, in a few minutes as she share her personal story with autism. Please share this live. Invite your friends and family to join us as we share some very important conversation that you do not want to miss. So thank you for joining the Friendly Counselor, and I will bring our guests on. There we go.
Oh,
Hi
okay.
there, Dr. Becca. How are you? Becca.
And then the lights should get better. I can
Sure.
can't even see you.
Yeah, so as long as you have, I know you're finding a spot to park.
Mm-hmm. One moment. Almost there.
And our conversation, yes, almost there. So we can definitely start by just giving a little snap on what autism is as a whole, and I like to invite our viewers to educate themselves on autism. Many times we hear about uh, certain disorders and we may not have the knowledge idea, but it's very important to go online and try to do your own research. And
Mm-hmm.
that is so that is the whole purpose of increasing awareness, especially within the African American community, within the Liberian community. This month, April, has been set aside to raise awareness on autism, but it's more than awareness. It's more for me, and you can probably share light on that. For me, it's beyond awareness. It's more of acceptance, right?
Mm.
When we talk about autism and people that are on the spectrum, for me, is how can we incorporate them in our lives versus looking at them as they're on that side and there's something wrong with them. So, how do we become more inclined to accept what is the difference that is as it relates to autism? So, it is not a mental disorder. I just want to say that, but it's right. Autism is rather a neurodevelopmental disorder, meaning it affects the brain and how the brain functions, impacting social interaction. So that is one of the key communication and behavior. So while autistic individuals can experience mental disorder such as ADHD and other explosive language type disorder, it is not necessarily a mental disorder. So I just wanted to clarify that. So that Becca, let's begin. Thank you for honoring my request to be here. I
Yeah.
know you're always ready anytime.
Yeah. Anything from my favorite doctor. Yeah.
Oh,
No
it's a
problem.
pleasure having you.
Thank you. Thank you for inviting me. And thank you for the live
Yes,
um
absolutely.
podcast.
So tell us a little bit about who you are. Tell us a little bit about yourself.
Oh, okay. Well, I'm Aretha Sogby Burkle. I am a nurse practitioner. I am a nursing professor, a wife, mom of four, autism mom, a Liberian, a Republican, and
That was
yeah,
important to
I wear
squeeze in there,
hat.
right?
Uh-huh.
Uh-huh. Yeah.
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 Um,
So go ahead.
I was, when I saw the flyer about today, I was very excited about this topic because as you know, people that know me personally, this is something, this autism is something that I'm very passionate about. It's an emotional subject for me, but I also look at it from an empowerment standpoint. So I like the fact that you said autism empowerment, and I was like,
Mhm.
yes, because you don't usually see those two words together in combination, you know. So I was like, yeah, I definitely want to be part of this conversation. It doesn't get easier every time I have it. I just, you know,
Mhm.
I put on a brave face and try to get through it. But
Yeah.
it is an uncomfortable space and it needs to be talked about because it's one of those things that when you haven't experienced it personally or work with someone that's experiencing
And
it, you have a different
conversation.
outlook on
Yeah, almost there.
it.
Mhm.
Yeah. So let's dive in.
I'm glad that you mentioned it's uncomfortable. Now, I have
Mm.
family members who are on the spectrum, and I
Oh,
know the parents struggle with just accepting the fact that hey, this child is on the spectrum. For a very long time, this was a thing. So you are absolutely
mm-hmm.
right. It is not easy to accept. And this is why I'm huge on that empowerment and acceptance, because it's beyond just this is a disorder, like most people see, and view autistic or children on the spectrum as, oh, there are so many different things about them. They are special. And I hate that word special. Uh, we have to understand that it is no different from any other developmental disorder, right? So let's dive in
Yeah.
a little bit more. Share your story with us. Tell us a little bit about your journey to acceptance.
Mm. Okay. Um, it's still a process.
Mm-hmm.
But it started about 3 years ago, roughly. 3 years ago, when my son was almost 4, was
Mm-hmm.
when I was sure that something was wrong because he was nonverbal at the time. He wasn't talking. But not just that, he wasn't making eye contact. He wasn't interested in the baby. It was just subtle things that was just not right. But I didn't want to believe it. You know, like I knew something was wrong or something was not the typical developmental stage or milestone. But you know, you have that thing at the back of your head that not my child, right? Somebody
Mm-hmm.
else's kid, but not yours. So eventually we had him tested. Um, and even though I thought I was ready for it, like, you know, I was expecting it, I knew the signs and symptoms, but when you hear those words, it hit
Mm-hmm.
differently.
That's
And
it.
I did not take it well. So I definitely was in denial.
Mm-hmm.
Um, where I got angry first, and then I went into denial, and then I went into the bargaining stage. I went through depression.
Mm-hmm.
I went through the entire grieving process.
Yeah. Yeah.
And I talk about my journey with depression, but I think the biggest issue was with me.
Mm-hmm.
Um, like this wasn't what I expected. This wasn't supposed to be my life story.
Mm.
This was my blueprint. My blueprint
Yeah.
was I was going to have a son that was going to talk to me and call me mama, and we're going to do all the usual things together, everything that everyone wishes for, right?
Mm-hmm.
So now experiencing this, I didn't know how to process it. The first thing I felt was guilt, and then I felt shame, and then I felt like, wait, did I do this? And you know,
Mm-hmm.
it's one of those things people like, well, at least you in healthcare, so you understand. No,
Mm-hmm.
it's different.
Yeah.
It is different when you're treating an actual patient than when this is your child. You don't even have that clinical judgment. Like I used
Exactly.
to be fighting, like for example, when the therapist, the behavioral health therapist come over to do like an assessment on him, I'm pushing
Mm-hmm.
back, I'm fighting, like I'm not complying with the process, even though I know better, because
Yeah.
it's just an emotional time when you're not processing. That's why, anger is not a good place to be, because you can't
Mhm.
see the whole picture, right? You see the trees
Yeah.
but not the forest, so to
Right.
speak. So that's where I
Right.
was. It took a while for me to accept that this was what was happening, and the sooner I accepted, the better I will be able to meet his needs, the more I'll be able to support him. So I had to get out of my own way so that he can thrive.
Mm-hmm.
And I talk about it, my personal journey, because it was a transformative period for me, mainly because that was the first time I did therapy. As
Yes.
a Liberian, therapy is not is not something that we engage in, but I would
Yeah.
say he didn't have any medical issue. He was physically healthy. So in
Mm-hmm.
that regards, no other associated, condition with the autism, just that. So
Mm-hmm.
I'm grateful for that. But I was in a terrible place. I had to come to term with it that this is the reality. And
Mm-hmm.
then I started getting resources for him. And then I ended up becoming an advocate, because I realized how ashamed I was to talk about it. I realized how depressed I was, and I was like, I wonder who else. And the moment I started
Yeah.
talking about it, people that I've knew for years finally
Mm-hmm.
told me, "Oh, yeah, my kid also have." And I'm like, "What? How?
Yeah.
How? You know? How?
Mm-hmm.
How did I not know this? Or why didn't you tell me before?" But like I said, it is a difficult thing for a parent, because everyone wants the best thing for their kid, and everyone has that blueprint. My blueprint was my child is supposed to be XYZ. So I had to sit down and reframe that blueprint, rewrite that blueprint, and say, okay, this is what I have, and this is, I need to adjust my expectation to this and walk in this path, because that's what has been
Mm-hmm.
given to me. I need to rise up to the occasion. Yeah.
Yes.
Right now, things hasn't really changed much, but
Mm-hmm.
our my perception has changed, my mindset, the way I cater to him, and I'm more coming from an empowerment standpoint. What can we do to meet his
Mm-hmm.
needs? Not like, oh my God, poor me. I've gone through
Yes.
that healing journey to
Mm-hmm.
a point where I am in acceptance. Yes.
Yeah, and I thank you for being so honest about the journey, the experience. And I'm sure so many moms in a similar situation can relate. Taking about the guilt. What did I do? Because we tend to
Mm,
blame everything about our children on us, right? What did I do something
yep.
wrong? Was it
Yep.
something I did when I was pregnant with this child? Did I not follow, certain things I was supposed to do? So we start to introspect, look within ourselves, and then we start to self
Mm,
blame. And in our culture, the Liberian culture, not only do we self blame, but we start to look externally as to what are the causes, the factors around me, what's happening around me, who's responsible for this. And that guilt,
mm-hmm.
like strive, that guilt of this is not how I imagine my son to be. I imagine a son that will communicate, that will speak to me, that we're going to, have that mommy and son relationship. And now it's not going to happen. So, and you mentioned therapy,
Mm-hmm.
which helped you along the journey, like you stated. And you
Yep.
said like now it's something that you're not 100% there yet, but it is a day-to-day journey, which I think it is so important to note.
Yeah.
Highlight. You just don't wake up one day and all of that is gone. The challenges are there. So let's speak a little bit to
Yeah.
when you came around that. I don't know if we can say part of acceptance or acceptance where this is my new normal. This is my life. This is my child. And I love him, regardless of
Mm-hmm.
this disorder that he is struggling with, I love him. So, what was the pivotal moment for you to arrive to that point?
I think it wasn't just one it wasn't just one big event. It was
Mhm.
series of things that culminated into reaching that point. And like I said, I went through the whole process. It wasn't just one day, okay, this is done.
Mhm.
I went through the process, and the grieving process, the acceptance, the denial, the anger. And I think what really helped me was coming back to my faith. And I'm not saying this to be
Mhm.
cliche, but
Mhm.
coming back to my faith, knowing that, I did not create this situation. And one, this was a child of God, and He created him, and He's ultimately
Mhm.
responsible for him. So I
Yes.
can just be a mother to him. I'm not in control of everything. So I think I said the serenity prayer, give them the strength to accept the things that I have control over, and to
Mhm.
let go of the things that I don't have control over, and the wisdom to know the difference.
Yeah.
So it took a while to get there, but getting back to my faith really helped me a lot
Mhm.
in the acceptance fit. And even now, it takes me, because there are days that it gets hard. There are days that you see your friends kids that is same age, and they're talking, and they post a video of their kid singing a song or something, and you like, you're human, and you
Mhm.
miss that, and you want that. And I have to get back into that space, and say God is in control, and my journey is not the same like everyone else, and I have to
Mhm.
love my kid for who he is,
Mhm.
and the rest is up to God, you know.
Right.
But my faith definitely helped me, and I did reach out to community, to the autism community. I reached out to other
Mhm.
moms that have been going through this, and I got support. I
Right.
try not to live in a silo where I'm drowning in my pain and acting like everything is okay. Even though
Yeah.
I did that initially,
Mhm.
but eventually I step out of that, and I'm like, I need support. It's okay to be vulnerable. It's
Mhm.
okay to be in this new uncomfortable space. Not that it's the worst thing that happened. I wouldn't say it's the worst thing that happened to me, but it was new, right? It's not
Yeah.
something that I was familiar with. So this was uncharted territory, right? So it was scary.
Absolutely.
It felt like this big thing that was going to rip my world apart.
Mhm.
But
Mhm.
once you sit down, you take it in, and you access your resources, you realize that, it's not as bad as I thought.
Yeah. Yeah.
and and then you start to be solution focused.
Mhm.
So yeah, it was all of those things: support system, be in touch with my faith, and then getting empowerment through knowledge, learning
Yeah.
more about, now what, how can I best meet his needs.
Exactly.
Yeah.
Yes, I cannot agree with you anymore. It's just being connected to your spirituality. And many times when
Hmm.
we are going through tough times, we want to be alone. We question God. Why me? Why are you allowing me to go through this? And these are the times that we need to draw
Yeah.
closer to Him, because the comfort we
Yeah.
get from God, we cannot get from nowhere else. So I totally
Absolutely.
understand when you say that faith. I am huge on my journey in just reading my Bible and sticking to what God has promised me. And so I'm happy to hear that, that is something that you are able to connect with. And so let's talk a little bit about the hero here, the superhero, right? Let's talk a little bit about some of his strengths. What are some of your son's strengths? You're muted.
Oh, sorry about that. Like I
That's
said,
okay.
he's healthy. He's physically healthy. He loves to jump around. He is such the sweetest kid.
Hmm.
He's so kind to his little sisters. And he's very affectionate. He just wants a
Yeah.
nice hug. He's a sweet
Oh.
kid. Um, I love that he's very gentle, and I
Yeah.
worry about that a lot,
Hmm.
because he's nonverbal, And when you
Mm-hmm.
cannot communicate your needs, you
Yeah.
sometimes get upset or you tend to develop anxiety. So, I'm constantly worried about that. But he is the
Yeah.
calmest kid.
Yeah.
He doesn't react to his sisters when they try to take his toys away. He just look at it and smile. He has the cutest
Mm-hmm.
smile. I
Um,
think his strength is he has family support,
mm-hmm.
and he's a happy kid. You know,
Yeah.
he's living
Yeah.
in a world of his own. He's a happy kid.
Yeah.
Yeah.
And as he grew older, he would develop more and more strengths. And of
Hmm.
course, just that calmness is a key to help him navigate through many difficult situations. So that is a huge, huge strength. Um,
Hmm.
one of the things that we as a community, one of the things that we struggle with is stigma. Stigma surrounding many
Hmm.
things, including mental health,
Yeah.
autism. Like I stated earlier, I know so many people, including family members, that have children on the spectrum. And within the Liberian community, this is such a struggle. This is not a conversation we want to have. This is not something that the girls want to sit
Hmm.
around the table and say, oh, by the way, my son is on the spectrum. We see, we notice, we observe things that are different, but we're so afraid to even have a conversation about it. And we who are experiencing it, we are also afraid to speak on it because we are afraid of being judged or the way that people will look at us, our friends, sometimes even our families. We are so afraid, and this
Hmm.
stigma is huge. And as I hear you speak about the resources that you were able to go out after you navigated that situation of denial, depression, and all of these grief stages, you got to the point where you say, listen, I need to show up for this kid. I'm the mom.
Yeah.
If I don't show up for him, who's going to, if I'm embarrassed about my child and I'm not showing up for him, what about the people around him? So I now have to teach them how to love my kid. So let's talk about the stigma a little bit. Let's talk about this stigma that our kids struggle with and our community, meaning the Liberian community at large. Let's talk a bit about the stigma. How do you navigate that?
I think the biggest stigma I encountered was my mindset. It was me.
Mm,
That was my biggest, stigma, because
yeah,
like you said, mental health isn't something that we're comfortable talking about, or it's something that we are exposed to, right? This is a
mhm,
new phenomenon for us in the Western culture. So being like, hearing that was scary for me, and I was afraid and I was traumatized by it. But it
yeah,
wasn't it wasn't it wasn't more on my child. It was like, why is this happening to me? Like, what if people find out? And I think I was more afraid
mhm,
than the actual stigma.
yeah.
I don't know if that makes sense.
It makes
But
perfect sense.
once
Yeah,
I accepted once I expected accepted what was happening, I realized that I need to be an advocate, and I need to create the space where other people can feel comfortable to talk about this, right?
yeah,
Because if you know better, you do better.
that's right.
So, and that's some of the reason I'm very open about my experience, because some people try to sugarcoat it like, oh yeah, it happened, you just leave everything to God. Yeah, you do, but you
Yeah,
were crying and this impacted your life, and
mhm,
this wasn't what you expected. And it's
right.
okay to be human, to process those feelings. If not, then it become long-term depression, right?
Mhm,
So yeah, there is stigma, and I think the biggest stigma is that people are not informed about,
yeah,
autism. So sometimes you get like, cliche statement like, I told you say your son was autistic. And I'm like, yeah, well, he looks fine, you know? And then I'm like,
mhm,
yeah, it's not a physical issue. But why is he jumping around and playing? Like, I told you
mhm,
said he was autistic. And I'm like, yeah. And then I have to explain that it's a spectrum disorder. And that's what makes it so,
yeah,
because one kid may have it and be here, and another kid have it, and it's completely different. No one child is the same.
right.
So that you have to keep informing and keep being an advocate, and I'm not afraid to speak up for my child. That's one thing I think you get as an autism mom. You know that it's you
Mhm.
against the world, and you have to advocate so aggressively, because there are times people would just stay in their ignorance, one, or they
Mhm.
don't understand. So I come from there with compassion. I don't say, "Oh, you so this, you so that." I try to tell you, meet you where you are. Hey, he looks fine because there's nothing wrong with him. He just
Yeah.
has a different way in which he process the word, and then I try to narrow it down. But in terms of my community, my friends, like, I haven't had that yet. There was just
Yeah.
one time that I broke down, and
Mhm.
this is something so like silly, but I will share it anyway. I went to a neighbor house and we
Mhm.
were visiting with my son, and we were playing, getting along, and I went to the car for like maybe a minute or two, and I came back, and my son has taken out his depends and smeared poop everywhere at her
Mhm.
house. and I
Mhm.
and I came in the house, and and just looking at her, the look on her face, she was actually crying, and then I
Mhm.
started crying, and I'm like, ugh. So it was one of those moments where
Yeah.
you
Yeah.
like, oh my God, why can't I just be like everybody else?
Yeah.
I apologize like a million times and try to clean,
Mhm.
and even offer to pay for the couch, and got
Yeah.
out of there as fast as I can. So there are
Mhm.
challenging times,
Yeah.
like instances like that. But
Mhm.
is life. You just have to keep advocating and keep telling what you know, because I can't keep living for the opinions of others. I've passed that stage. I
Yeah.
already been through it with myself, and I've overcome it internally. So now it doesn't matter what anybody else think. Is how can I show up for my kid, and how can I show
Yeah.
up as me authentically? Yeah. But the
Beautiful.
stigma is real,
Yeah.
and I try to talk about it as much as I can, so that people around me, or so that any mom would feel empowered, like it's okay to talk about this. I'm not saying you should center your life around it, but
Mhm.
it's a conversation that needs to have, so we know. The more we know, the better we would do. Yeah. I
Absolutely.
don't know if I answer your question.
And you answer it and beyond. Thank you for that information. And I must say, Dr. Becca, you have this inner strength, and I know many times when we are navigating challenging times, especially with our children, it is easy for us to have many breakdowns here and there. And you explained that moment where, of course, it was, my gosh, why am I dealing with this? But at the same time, you
Mm-hmm.
handle that situation with grace, and I applaud you for that. And I also applaud you for the fact that you are not keeping your son in a vacuum, right? You're not just boxing him in a place where he stays here, being embarrassed to have him around other children. Because again, these are some of the things you hear parents struggle with. I don't want his peers to make fun of him. I don't think they're going to know how to play with him, or he's not going to know how to play with them, or she's not going to know how to play with them. And so I just leave him home. I leave her home, and I feel bad, but I don't know what else to do. So I want
Yeah.
you to speak to that mom, that dad who is listening right now, who is navigating similar situation. I want you to share some tips on how
Okay.
they can help empower their child or children and help them thrive.
Mm-hmm. So, as a parent, personally, what I do, I would say, is show some compassion to yourself, because we are usually our worst critic, right? We are
Yeah.
hard on ourselves. We think everybody's going to notice the worst thing, and we over process stuff. So
Mhm.
sometimes you just have to be gentle with yourself.
Yeah.
The world is going to take whatever you give it.
Exactly.
Okay. So if if it takes time, I'm not going to tell any parent, oh, just get out of the house and do this. I would say work on yourself, because
Mhm.
if you are so afraid of what the external world has to say, that means you are processing it, right? If you're okay internally, if you do that inner work, that this is what's happening. I love my child. I'm going to show up for you. We are going to make this work. This is our word. This is our reality. The world will
Mhm.
conform, right?
Yeah.
So instead of trying to please people or make things comfortable for them, you're
Mhm.
focusing more on what is important for you and your kid, right?
Yes.
So like
Yeah.
I said, you don't owe anybody any explanation. So i don't
Exactly.
i don't keep my kid in a vacuum because I don't know how other people will play with him. I expose him and then I'm there, so that
Yeah.
I learn, because you never know what's going to happen. But I learned from that experience. He learned from that experience. i
Mhm.
I have to allow him to process life and live life to the best of his ability, you
Yeah.
know and
Mhm.
but if that parent is not there, they're not in that acceptance stage where this is how they want to present to the world, then it's a little different. So my tip will be, work on yourself,
Yeah.
work on reframing your blueprint,
Mhm.
work on accepting this kid for exactly what they are. How can
Mhm.
you meet their needs? And once you've come to that resolution, it doesn't
Mhm.
matter what else anybody have to say. That will
Yeah.
be my tip, because I go through that on a daily basis. And for example, I have 4 kids.
Mhm.
When I go to church, I go to Sunday school, and I know my kid is not going to sit down in Sunday school. So
Mhm.
do I leave him home or do I take him to church? I bring him to church and he sits right by me. If he wants to
Mhm.
sit in the chair or turn the chair around, I just tell
Mhm.
everybody this is how he likes to do. Just ignore him, right? And I'm
Mhm.
okay with it. And I try to
Yeah.
tell everybody this is how it is if it's not bothering you, and then they make it loud. People will understand.
Absolutely.
People want to show compassion to a child, right? So
Yes.
the more exposure, they realize that this is reality. This is
Yeah.
things that happening. These are people.
Mhm.
They're part of our lives. So
Exactly.
again, it starts with you, right?
Yes.
It started with me.
Yes.
As soon as I realized this is the new norm, I am going to fully immerse myself into this.
Yeah.
I owe no apologies to anybody.
I love
Yeah.
it. I love it. I love it. Showing up as it is. This is me.
Yeah.
This is my child. You can take us or leave us.
Yep.
Now, if we had a child who were struggling with ADHD or other behavior issues, um, it wouldn't be any different. So why should it be
No.
different with spectrum disorders? It should not be different at all. And we,
Yep.
as caregivers, it is our responsibility to teach others how to accept, definitely accept, and to love our children. Because if you are not
Mm-hmm.
accepting of my child and I show up in a place where, there are comments made or I see faces, well, then maybe that's not the place for me. And I
That's
have
not the room I should be in.
that is not the space I should be in, right? So recognizing which spaces are safe, welcoming for me and my child, these are the spaces
Mm-hmm.
I will put myself in. If I am in a space where the children are being aggressive, because of course my son is nonverbal and they don't understand, well, I want to educate them a little bit about what's happening. So, which kind of leads me into my
Yeah.
next question. What are some of
Mm-hmm.
the triggers that your son experiences on a daily basis or quite often?
Oh, he has sensory issues, so he doesn't like loud noise. Like
Hmm.
whenever there's like loud music, he cover his ears. So he gets the noise cancellation
Hmm.
headphones, which he doesn't like so
Yeah.
much. But he has access to that, so he gets a little overstimulated when there's too much noise.
Hmm.
He's a very picky eater. He doesn't like anything mushy or wet. Yeah, and he's a water bug. Anything
Oh,
water, he's in.
Yeah.
um, yeah, but mainly noise is his trigger. That's about it. He would just put his fingers in his ears
Yeah.
and try to
Yeah.
soothe himself. Yeah. Hmm.
Mm-hmm.
But he's used to he has a full house, so is different when you like a only child, but the other
Mm-hmm.
kids won't let him be, right? So they
Yeah.
just disturb him and he's just going with the status quo pretty
Yeah.
much. We don't
Yeah.
treat him differently, we don't treat him
Mm-hmm.
special. Like he's just like everybody else. He gets, if
Right.
he gets in trouble, he gets time out, like he gets punished,
Mm-hmm.
like he iPad, he can have access to it. We treat him like anybody will want to be treated. So
Of course. Of course. So, with him being nonverbal, how does he communicate his needs?
He's learning to use the AAC device. He has
Yeah.
an iPad that he uses for communication. He uses gesture, and he sometimes he points, but he points with his middle finger. So I tell
Okay.
people he's not cursing. He's just
Yeah.
he's
Look,
pointing.
I need him any
Um,
given day to take him to some of my meetings.
Sometimes you need to stick up, right? But
Right?
he knows he's pretty, he liked to be independent, like, so he would try to
Mhm.
go for things himself, and then we gotta be
Yeah.
like, oh, you want this, but yeah, he will come and pull you. If he wants something, he's very persistent. He will come and get
Mhm.
you and take you to what he wants, but he knows his way around the house, so he just get what he wants. But when we're going outside,
Mhm.
um he's learning to use this device. So I'm hoping we'll reach that point where he can tell me he wants to go to the potty, but now he doesn't do
Okay.
that. So I have to take him
Mhm.
like every hour or so. But he's potty
Yeah.
trained.
Good.
Yeah.
Good.
That was a whole different story. We don't even have time for that. But finally we reached that milestone.
That's now, yeah, yeah,
Yeah.
huge milestone, and it's it is not an easy journey. I understand it. Um, how does he interact with other children?
He observe a lot. He plays with his siblings at home. Like I said, I have two younger kids younger than him. So he plays with them. He like hide and seek. He like running. And
Mhm.
sometimes he just want to be on his iPad. So it depends on the
Yeah.
day. But
Mhm.
he's very interactive now. There,
Okay.
like for the past 6 months or so, he's engaging. There was a time when he wouldn't even notice them around. So
Mm.
now he's like actually noticing and following along and trying to
Mhm.
to play along. But a few months ago he wasn't there developmentally. Yeah.
Mhm. Yeah. Making strides, which is great. And as it
Yeah.
relates to services supporting his development, did you experience any challenges? If so, what were some of the challenges you experienced?
Oh, definitely. Is challenges on a daily basis. One, getting the right person. Like once he got diagnosed, we had to do the recommendation was to do
I think we kind of lost Dr. Becko for a minute there. So if you're just joining the live, I thank you for joining the Friendly Counselor. The topic for tonight is autism, empowerment, and acceptance. And Dr. Becko is sharing her journey, her story with autism. We would like to encourage anyone listening tonight to educate themselves on this disorder. I know that many times within different cultures, especially our Liberian community, we hear about these things, but the stigma that follows it, we are not knowledgeable about some of the challenges. And even if we're experiencing it, we are not open to discussing it. And so the month of April, and it's global, it is not just in the United States, it is a global awareness month for autism or spectrum disorder, like we call it now. And so we are highlighting some of the struggles. One of the things that was shared is just making sure that day to day these individuals feel supported. One of the way that we can show up for them, allowing them to be accepted, not making them feel different from the entire population. As we look at children on the spectrum, adults on the spectrum, we want to understand that this is a developmental disorder. It is not a mental disorder. So, developmentally, some processing is off. Let's just put it that way. There are difficulties processing, but it is not a mental disorder where they don't understand. Now, they may have struggles such as communication. There are some who are verbal, there are others who are nonverbal, and some of the challenges that they go through. And as we encounter individuals on the spectrum, remember that they are observant, they understand based on where they are and what level they are on. They understand. They know what's happening around them. So when we now start to treat them differently, they know, they feel it. Dr. Becca is back. Okay.
Yeah, I'm
I
sorry. My phone just went off for no reason.
I know you'll be leaving us shortly. Um,
Mhm.
and I wanted to just allow you to give a few words, parting words. So anybody listening, how do they navigate this journey with grace, with compassion? I think that is super important for any type of situation that we go through life.
Yeah, absolutely. So to any parent that is anyone who have, I know you say you don't like the word special needs child or neurotypical kid, I would say I'm praying with you. You know, it can be difficult getting to a place of acceptance or fully supporting your kid to get them to reach that point. They have, depending on the resources that they have, they can grow up and flourish, and things can change,
Hmm.
but is what you put in is what you're going to get out. So the
Absolutely.
sooner you get out of the negative mindset and feeling like the whole world is against you, the sooner you
Yeah.
start being more action focused, solution focused, than, being in a pity party, the sooner things would change. And I know that's a little harsh, but I am a living witness of that.
Hmm.
And it's just different. They're different. They experience the world differently. And it's not just autism. I think, when it comes to mental health or anything neurotypical in our community, there's this big stigma because we're not familiar with it. But you know what? It's time to get out of our bubbles
Yeah,
and and adapt to the world around us, because things are, these things been around. We just didn't know what it was before. We
exactly.
attributed a lot of them to witchcraft. I have people that
Mhm.
told me that this is witchcraft. I need to pray
Yeah.
it away, and need to check in my family and see which one of my aunts don't like me or whatever.
Mm.
And I said, okay, we will pray about that, and then we would treat the physical symptoms, like the two can
Yeah,
coexist, right?
that's right. That's
Um,
right.
so what I would say is you can handle whatever cards you've been dealt. You are
Yes.
fully capable of handling it.
Hmm.
And you need to find your people, you need to find your tribe,
Yeah.
and you need to find those people that will support you so that you can flourish.
Hmm.
Because if you stay in the same negative environment, you are not going to reach that point of acceptance, or you're never going to feel empowered.
Hmm.
So reach out to your resources, talk about it to people that you trust, because not everybody feel comfortable having this discussion. Even right now, there are times, every time I do this, people that know me reach out to me personally. I don't understand how you do that. Like, some things should be private. You
Yeah,
will get criticized regardless of what you do. You just have
that's
to be
right.
sure what you want to do and live your life for you.
Mm-hmm.
So if you feel comfortable talking about it to, to in groups, that's fine. If not, people that are closest to you, just don't carry it alone, because this isn't a burden to be carried along, and it's not something that you can fix, you know.
Yes.
So realize what you can change and focus on that. And
Mm-hmm.
the things that you cannot change, try to accept it or find a
Mm-hmm.
way around it. But either
Yeah.
way, take care of you. You're doing the best you can. It's not easy raising any child. You know, there is no guarantees. You can have everything going perfect for your kid. Just the other day, I lost a 21-year-old healthy kid that was in Ivy League college, was
Mm.
doing everything possible, and all of a sudden dropped from nowhere, and he
Mm.
had a large heart and it died.
Mm.
So, you never know what the outcome is going to be. So do not ever give up on your situation. Keep fighting, keep showing up, and keep living to the best of your ability. You know? That's all I can say. You never know. You can't say
Yes.
this person's life is better than mine, or oh, I feel so sorry. We all have our own crosses that we're bearing, right?
Yeah.
So to any special need mom, or to any mom that's not sure what's going on, I would say be gentle with yourself. You are
Mm-hmm.
not alone. You're not the first person that this happened to. Be
Yeah.
gentle, pray about it, talk to trusted people, and take care of you. Because if you are not whole, you cannot pour into that child. If you're
Yes.
not whole, you cannot help that child.
Mm-hmm.
You need to be okay, because you are the one that really, the moms are the one that really doing the nurturing. You need
Of
to be in
course.
that safe space to be able to be there for them, because they feed off your anxiety, they feed off your pain and your fear, and they just want to be loved. So
Yeah.
again, and not just a child, a adult as a whole, or even you, your mental health. If you feel depressed, you feel like this is not me, something's changing about me, talk about it, seek help, take care of you. Don't
Yeah.
worry about everybody else. That would be my conclusion there, Doc.
Words
Thank you
of
so much
wisdom.
for having me,
Thank
and
you for coming on.
I'm very grateful to you for having difficult conversations like these. These are not the kind of topics that will go viral, because you're
Mm-hmm.
not only negative, but
Yeah.
these are the conversations that are much needed in our community. And even if it's few people that it's happening to, even if it's just two or three, those lives are going to be impacted. And if anybody want to reach out to me personally, because in this in this journey, you need people, you need good people, you need
Yeah.
resources. And don't be afraid to reach out and pray about it and do what you can. Thank you so much for having me.
Absolutely.
I'm very grateful.
Thank you, as always, for sharing those words of wisdom. And I know it will be a blessing to many listening, even to those who may be in the struggle and feel that they're alone. Our stories are powerful. And I continue to encourage you to be an advocate, be a voice uh, out there in the community and for your child. Thank you so much for coming on. And so, okay, there we go. Dr. Becca had to leave. And we will continue as we finish up the live. Autism, it's a disorder that, as you have heard, uh, struggles with processing those individuals that have it. And there are so many ways that we can go about teaching our children or those individuals uh, going through autism how to interact appropriately socially with one another. If you experience or if you recognize at a very early stage of infancy that this child seems a little different and maybe it might be spectrum disorder and follow through with the testing and it's in fact spectrum disorder, there are some things that we can do to engage moving uh, social engagement. So, number one, we want to work on those facial muscles, right? We want to make sure that we are playing, massaging We are making sure that the giggle, the laugh, we do whatever we can to invoke smiles, giggles. I think I mentioned earlier, when we find ourselves around individuals who are on the spectrum, this is not the time for you to treat them that, oh, something's wrong with that person. It is the time for you to be warm and friendly. Please stop staring at them. There are regular folks like me and you, and they can feel. They know when you are staring at them and you are making faces or what have you. If you have younger children, teach them to understand that this child is no different from you, right? So let us be respectful of that. So, for younger children or infants, one of the things that we can do too is to teach those facial emotions using mirrors. So I work at Johns Hopkins Autism Clinic in Baltimore, Maryland. And one of the things that we did to kind of help teach social engagement was to use not only the mirrors, but we were using little charts and things to kind of help them to point out words, because if they are nonverbal, they're not going to tell you what they want. Now, Dr. Becker just shared with us that her son has the iPad. Many folks are using the iPads now. There's so many other devices, the smartwatches, the iPads that they can use to communicate. There are apps, there are programs that they can communicate. We want to be able to teach some of self-soothing. So what are ways that they can self-soothe? So one of the things that we used to do is to help them to create little things in the clinic. For example, we will create a board that had rice on it. We will use glue and we will put rice, stick that to the board. We will stick beans, different types and sizes of beans that they can kind of rub to get that sensory way to soothe. So what do I mean soothe? When the child is having a meltdown, where they're yelling, they're screaming, they're hitting their head, they're throwing a tantrum, they are trying to break stuff. How do we bring them down to baseline? That's what the self-soothing is about. For some kids, they can use different stress balls or different sensory balls. There are different sensory toys that you can buy. Uh, why a child is in a meltdown, it is not recommended that you're yelling at them to calm down. Shut up, be quiet. All of that, they are triggered by loud noise. So if you are trying to bring them down to baseline, check your tone. Make sure that your tone is at a low, non-threatening level. You are speaking to them in a way that they don't feel that you're a threat. You want to be firm, you want to be clear, and you want to be precise, but at the same time, you want to be able to communicate with them in a way where they don't see you as a threat. And if it's anything around you that you can help them to self-soothe, utilize that, because most of the time they're able to bring down their baseline. So when we talk about children on the spectrum, we empower the parents to be therapists, because we as the providers, we are not in that home 24/7. So that is where that advocacy is about. How do you show up for your child? And as we heard Dr. Becker's story, she had to go hard for her child. And many times you find yourself in those situations seeking help, resources. There are many different options out there. You will hear about ABA structure therapy that is specifically used for spectrum disorder, where it is directed by the therapist. That is what I explained when we work at the clinic at Johns Hopkins with the families. So there are pros and cons to all of these things. Some pros to ABA therapy is good for analyzing and finding the triggers. So I'm able to find out what is Johnny's trigger and I can speak to it. For example, if he's in a loud space and he gets triggered and he starts to go like that and bang his head and bang his head, hit his head or hit things, he is triggered. So what do I know now is that Johnny is triggered from loud noises. So now I need to make sure that if I have him around loud environments, I am equipping him, whether it is on noise cancellation headphones, or some folks may use earplugs, whatever it is, to help him not to be triggered by that. Uh, so making sure that we have those things in place. When it comes to sensory ability, 5 to 16% of children have significant sensory deficiency. So either they are oversensitive, they are undersensitive, or they are seeking some form of sensation, or overall they're seeking sensation. So when you hear therapists say regulate emotion, you will hear your doctor, your caregivers, or your therapist say we need to learn to regulate the kid's emotion. It's just plain and simple expressing emotions in a socially acceptable way. That's it. Controlling the intensity of the emotion and adapting to that emotional regulation. So we want to be able to effectively find ways to cope, find ways to navigate through difficult situation. What we see as the child is having a tantrum, most of the time they're having a meltdown. And this is one thing I want you all to understand. You cannot stop a child in the middle of a meltdown. It's not going to work. They have to go through the entire phase of that meltdown. So if it means you have to sit there with them and self-soothe, if there are head bangers, you want to be able to hold them in a way where they are not hurting themselves. At the same time, you are having a conversation or you are being completely quiet. You will understand how to work with that individual. There are individuals where when they are having meltdowns, talking to them is triggering. So you do not speak. You want to make sure they're safe. At the same time, you want to allow them to go through the process of the meltdown. So what are they seeking? Are they seeking? Are they overly sensitive? Are they undersensitive? Are they seeking sensation? Many times we need to be able to understand. And so I encourage all of you, educate yourselves on autism spectrum disorder. It is not something to be afraid of. It is time that we empower individuals that are on the spectrum. Instead of removing them from society, we want to include them and accept them and understand that their challenges is more so on the point of the way that they process, the way that they see the word. Now, will you have a few that you encounter that is nonverbal? Absolutely. But there are ways that they can communicate their needs. And it is up to you in acceptance, learning how they communicate their needs. You cannot say, I accept this person, but at the same time, you struggle with the fact that, hey, what they're saying, I'm just going to forget about them. Let's empower them. Let's not alienate them. Let's make them to understand that we are here, we are safe, we love them, we are inclusive, we understand, even if we know sometimes it's difficult, but we are here for them. Show up in spaces where you are accepting, you are warm, you are friendly, you are doing everything within your power to enhance this experience. I thank you all for joining the Friendly Counselor live. Again, you can always re-watch this live. I encourage you all to share this live with your friends and families. And somebody listening tonight may not know much about autism. There is a great organization called Autism Speaks. Follow them on Facebook, follow them on Instagram. They have lots of stories that they will share online. If you are struggling or have somebody who is on the spectrum and you may not know how to navigate the situation, I need you to go to autism.com. It is a free website that is loaded with information. This is a global situation. It does not only happens to people in the United States. I know so many folks in Liberia that are on the spectrum. And we don't talk about it. We keep it as a family secret. There is no need to suffer silently. Find your community, find your people, find those that will be accepting and understanding of what you are going through. The NIH has wealth of information out there. So does the Autism Society. And many communities have information. Go online wherever you are, Google autism resources. Educate yourself. Make sure that you have the tools you need to help that child, that adult thrive successfully. Thank you for joining. I am Dr. QUITA Roberts. I hope you will join me again next week as we discuss further on more topics on the Friendly Counselor. Have a great evening, and don't forget your blue for autism awareness. Thank you for joining.